Do you know a teenager just tells me I got pregnant because my friend told me when you have sex while standing you will not get pregnant. All the semen will go going down. You see now?
You don't believe the news headlines? Fine. But please do not dismiss the voices of young girls calling out for help.
Dear Father, I would like to ask you to help me with an issue I have been facing. There is a man who is forcing me to have sex with him, but I refuse. When I was sent to the market, he said that he will come when you are away and kidnap me. Please help me. Dear teacher, I was walking from school and one boy stopped me and was asking me to have sex with him, but I refused and ran away. I would like you to help me. Dear Chief, I would like to request you to help us get basic needs, especially in junior secondary school. We need a lot of guiding and counseling as many of our peers have been dropping out of school due to teenage pregnancies and poverty. Please help us reduce the numbers of school dropouts.
Listen, our girls are in danger as they walk to school, as they stay at home, as they seek support for their basic needs.
Kuna marafiki wengine anaweza kuambia nini yeye alikuwa na boyfriend jana, sasa anaona anakudanganya pia wewe uende, pia wewe uende ukafanye sex, na saa zingine mimi wanawakataza. Kuna wengine wanaenda kufanya hivi ili walipwe wanunue tumie kama basic needs hawana.
A child under 18 cannot give consent. Right, so if a girl who is 17 years got pregnant, the man who is responsible actually violated a child.
The reality is that teenage pregnancy robs young girls of their future, forcing them into motherhood far too soon and leaving them with a lifetime of uncertainty.
Yeah, in my current session, every KCP year we have had a dropout. Two consecutive years because I've been there. This is my 4th year. For the 2 years I was there, we had, at least in class 8, we used to have a student who is pregnant. Maybe could go home because, you know, sometimes he feels shy. There's that stigma with the other learners and comes back to do exam. Sometimes there's one who came back after even she had just delivered.
In Kenya, 15.3% of adolescent girls live this harsh reality, compounded by poverty, poor healthcare, and rigid social norms. To confront this crisis, the Kenya Human Rights Commission drove the Red Card campaign under the auspices of the Reproductive Health and Rights Alliance. Aimed at calling out governors of counties contributing to high rates of teenage pregnancies in Kenya, the evidence-based campaign highlighted 20 counties, the first 10 for their contribution in number, and the second 10 for their contribution in national percentage of teenage pregnancies, respectively. Nairobi, Bungoma, and Kakamega emerged the worst affected, according to the Kenya Demographics Health Survey 2022. Unfortunately, the response from some leaders around this issue remains dismissive, pointing to gross human rights violations of the rights of children. A visit to Kakamega County, ranked 3rd in contributing the highest number of teenage pregnancies countrywide, was an eye-opener to the real battleground and crime scene that Kenya has become.
In fact, from our data, about 20% of the first ANC mothers are aged 19 and below.
Like Kakamega County has 12 sub-counties with 60 wards, and then in those sub-counties we have health facilities which are reporting a number of adolescent pregnancies, HIV infection, mostly in the youths, 20 to 24 years, and then sexual gender-based violence. Yeah, like for now, the leading in gender-based violence is Malava sub-county. HIV infection is Butere sub-county. Teenage pregnancy is Malava sub-county.
Here, Poverty, school dropouts, and harmful social practices fuel the triple threat: teenage pregnancies, new HIV infections, and sexual and gender-based violence.
Most of the kids are being raised by the grandmoms, and the grandmoms and parents are so careless. In fact, they're the one advising them to do so.
Most of these girls fall into this space because of lack of basic needs, including things as what you might consider little as sanitary pads, leads them into early exposure.
Resolve Communications stepped in to initiate interventions in Kakamega County with support from Planned Parenthood Global. Activating our mission of connecting communities to solutions through innovative and impactful communications, we organized a 2-day medical legal training for 26 healthcare providers and promoters from the county's 12 sub-counties.
Think about, how do I stop the pregnancy vis-a-vis how do I provide post-abortal care. It's the same thing with HIV. You'd rather have someone negative than have someone positive.
This crucial training equipped the providers and promoters with tools to navigate the complex legal frameworks around SRHR that often pose as barriers to a comprehensive SRHR response to the prevailing triple threat. In Ikolomani, the epicenter of teenage pregnancies in Kakamega, we initiated action-provoking community dialogues. The area chief and sub-chief, village elders, teachers and teenagers spoke candidly about the deep ties between poverty, lack of information, and rigid cultural norms. Their voices underscored the urgent need for solutions tailored to their challenges and the essential role of healthcare providers and promoters.
When it comes to contraceptives, let me say the community is still reserved. Still like there is, youth are not supposed to be doing, playing around with each other. So having sex, it is like, it's a no. So, and unfortunately, it's happening.
We actually need a concerted effort between the leaders, the community leaders, we health providers in the reserve, and also the county government in collaboration together, because part of our core value in Kakamega private health sector is collaboration. So we need that collaboration to reduce the numbers within Kakamega County.
For prevention of teenage pregnancy, the first approach, let's give these teenagers information.
It takes a village to build a future where every teenager has access to safe, dignified reproductive health services.
For my case, what has helped me to intervene, I do family planning for the teenage. I do the family planning to them. Some they come voluntarily, some they come with their parents.
Because like now, like if you go to Ikolomani, if you identify that area where we are having, those are people with go, if you get these people, their parents, put them together and talk to them, you will be preventing more pregnancies than getting these ones. We treat them and we leave them like that. And I know information will be able to dispel even the myths and misconceptions they have. Because if they get information, if you have sex without protection, you will get this. Because after college, after circumcision, they are told, even if you are circumcised at 8 years, you can have sex with any woman. You see? And it is in them. How do you help them? If you are, in case you are defiled, how do you speak up? Where do you go? We have this package of first line response to gender-based violence. That is identifying that before it goes to complications, getting HIV, and with the first 72 hours. These youths need to get that information because we've gotten a number of youths coming to deliver, even adolescents coming to deliver in the facility as a result of rape and defilement.
When people talk about it, there's a way people become conscious about it, and even the girls now will take more precautions. Now, as a county, we are very happy because the First Lady, Professor Janet Baraza, has a program to basically take back teenage girls who by bad luck got pregnant to schools. And she also has a lot of community engagement to talk to the community leaders, to talk to the parents, talk to the households about the challenges of teenage pregnancies and HIV and GBV. So that's the first step we are in. Currently, she's supporting about 60 teenage mothers back to school. Yeah, those who got caught up, unfortunately, so that they go back to school and they're able to live their dream through education.
Change is on the horizon, and Kakamega County is too pressed to wait for the tide to shift.